Great. Hello, everyone, and Happy New Year. It is 2:32 on Monday, the 13th, 2025, and I am calling this session of the Health Equity Committee of the City of Norwich to order. We will start with roll call. We'll start online. Kate Mildy.
Here.
Patrick McCormick.
Here.
Melissa Myers.
Here.
Chief Daly. I think you're muted, Chief. And Dr. McCormick is here. Okay, Sheila Hayes.
Here.
Rob Scalise.
Here.
Joe Zuzell, I am present. And Chief Daly?
You're unmuted now, Chief. But your camera went away.
Just doing some roll call here, folks. So Dr. McLean? So I'm on mute. But I can't really hear him, so. Well, let it be seen that.
Were you guys able to hear me?
Yep, we got you now. Dr. McLean and Chief Daly are present on the call as well. Okay, so let's move on down our agenda here. We've done call to order, we've done attendance. There's no citizen comments. Approval of minutes. So I would like to entertain a motion to approve the minutes that were submitted from our previous meeting.
So moved. Second.
Perfect. Yep. And a second from Melissa Myers. And we will go around. It was Kate. Yep. And we'll go around in order for our vote for approving the minutes as they are. First of all, is there any discussion? Amendments on the minutes? Okay, great. So Patrick McCormick.
Approve.
Kate Mildy.
Aye. What?
Yeah, approve all of the minutes.
Yes.
Melissa Myers. It's the first one out of the year.
Aye.
We're getting started
You know
slowly.
what?
Dr. McLean.
Approve, aye.
Great. Dr. Qureshi, approval of minutes.
Approve.
Great. Chief Daly. Still having trouble hearing you. Sheila Hayes.
Yes.
Rob Scalise.
Aye.
Joe Zuzell, aye. So minutes are approved. Thank you.
I just want to mention that Dr. Qureshi has joined.
Oh yeah, so Dr. Qureshi has also joined the meeting. He has made apparent for his vote of approval of the minutes. Great. All right, so moving on, we're going to chair updates. So I do have a couple of things today I did want to bring to the greater group. So the first one, I was contacted today, and I'll just pull up this email so I can read it to you. I was asked to bring it to this meeting. So a well-meaning group of Norwich residents has committed to sponsoring a refugee family of 5 from Syria. The family arrived on January 10, mother, father, girls age 5 and 6, and one boy 4. Looking for help in getting initial health exams, setting up families' relationships with the healthcare community. The group has purchased car seats and have a number of people who can transport the family to any appointments. I'm just making sure that we have this family on our collective radars. If there's anything I can get back to this concerned group of citizens in terms of helping or assistance or anything that we're doing. So I just want to make sure everybody is aware of this, or if there's anything that we need to do.
Joe, did they say they had tried and not had luck, or hadn't tried yet, or?
They don't know any of the status on what is happening yet, so I'm just kind of like putting it out there to this group because I know we're sort of all involved. Is this on anyone's radar, or is anybody currently working with this family? Have we connected yet?
Yeah.
I would have had to have known ahead of time and researched before this meeting, so
Gotcha.
I couldn't tell you.
So my understanding is it's Carol Clammer and the group, it's a a group that she's a part of.
Okay.
They're using the Jewish Federation. When I did this, we used Iris. So this is in the Jewish Federation.
Okay.
They are housed, a person I know has a unit that she normally rents out as an Airbnb, but they had contacted her. And so they will be there 2 or 3 months.
Perfect.
Okay, so that's all set. Because I don't know much about how the Jewish Federation works. I know how it worked with Iris. Is that we would have to take the families to New Haven. And that's where all of the immunizations and at least the beginning, the very
Okay.
beginning of it. They used to do the interventions, in the vaccinations and all of that. While people here in Norwich reach out to the various organizations. And so when I asked the person who's doing the rental, because I did see her, she said that they're supposed to have people in place
Okay.
to reach out to the various organizations. Like I said, well, what about Norwich Public Schools,
Right.
for enrollment and certain things. So
Right.
I know the Jewish Federation is their fiduciary. I just know Carol Clammer is, and I do have her contact, is one of the individuals. I don't know if she's the main individual, but I know she's one of the individuals
Okay.
who work to bring this family here.
Patrick, is this family on your radar? Have you seen them at the health district or anything?
No, I haven't heard anything about
They
them.
just arrived.
Just
They
arrived.
Just arrived.
Okay, just got here.
Friday.
Okay.
Thursday, Friday. I mean, they're
Makes
brand
sense.
new.
All right, perfect. So what I will do is I'll follow up with the person that Sheila is talking about and the person who's sort of leading this group. And then I will, with permission of the committee, give contact information for various organizations so that they can reach out. Is that comfortable with everyone?
Yeah, for sure.
All right, perfect.
Yes.
Good. Well, I like these little things that we can kind of do together. So appreciate that. I have one other update as a chair update. So the meat of what we're going to talk about today, we might not use the entire meeting either. It's just basically the survey, where we're going, how we're going to synthesize this data, how we're going to put it together, any hiccups, any barriers, any opportunities while we're sort of filling it out. But one of the things I know that is happening because we're in the middle of our community health needs assessment is that Mark Abraham from Data Haven has reached out to the City of New London to present the well-being data. And he's already done that. And I'm just wondering if the City of Norwich has gotten the same request from Data Haven, specifically Mark Abraham, and if there is an opportunity for us to maybe even do that or to grab some of that data from the well-being survey, particularly around health equity and the makeup of the town, in order to be able to also include that in our health equity report. So open that up to city folk. Any contact with Data Haven?
He reached out to me last week. This is Patrick for Uncas Health. He sent me some data for the district, and then he sent me data specific to Norwich and thought it might be helpful. I just said thank you. The
Yeah.
data wasn't as up to date as I thought it would be in terms of the years that he sent me.
Yeah.
So I actually was going to run it by you and see if you had more up-to-date information than what he sent to me. And it was just a kind of a cold email. I hadn't reached out to him before. He just sent it out kind of randomly.
Yeah. That's one of the reasons why I'm asking too, because we've been doing a lot of work. I mean, those of you who have been involved in this, it's both collaborative, it's Yale New Haven, it's Hartford Healthcare. We're trying to do a regional community health needs assessment. So I'm just wondering why he reached out to New London and why he wouldn't reach out to Norwich. Is that a standard practice? Does Data Haven usually reach out to the city to go over the well-being survey with you guys?
Not to HR.
I've
Okay.
never heard of that happening with human services either.
Isn't that interesting? I'm gonna take a note on that. I know he talks to you, Patrick, so I appreciate that information too. Did he want to present any kind of a health equity report, or was it just kind of like high level well-being?
Yeah, I just actually emailed it to you, so you should have it if you
Oh,
have your
perfect.
email. It should be right in front of you.
Great.
But it wasn't, he just said, I'm sharing it with you if you look at the email, sort of. Sorry, let's get out of it.
Yeah, I'll check it when it comes through. So I guess that brings me to my second question, though. It's going to be really nice for us to have all of the data from our own agencies, but do you think it might also be pretty powerful in this equity profile / report that we're putting forward to have data from Haven specifically, and obviously more relevant in terms of timeliness for the data to be also able to put into the report? I can tell you from our standpoint that I do have access to the community-based asset needs survey that we did, which is a shortened version of the well-being survey, which we did through a QR code and through our collaboratives in order to get a perspective, like regionally, what that looks like from, even New London and Norwich, so the region. I'm just asking about specific Norwich data because if that's already been sort of teased out and synthesized, and that was an offer that was made to anyone, that's something that if we capitalized on, we could flow that into the report pretty quickly. You guys see where I'm coming from with this?
Yeah, I'm all for more helpful data, but I haven't been courted with any of it.
I mean, I think, not to use a terrible pun, but this is a great data point for our actual health equity plan, because if the city of Norwich is not being shared the equity profiles or the well-being survey, I think that's a big gap. I mean,
But has it
Hey,
been
can
done
I-
in the
oh.
past? Um,
Go-
Kate, has it been done, or Patrick? Have they done it in the past?
Again, I couldn't hear.
has Data Haven ever shared any of this data with the city in the past? I mean, I know he shares it with you, Patrick, but
So he's always wanted money for what he shares.
right.
So it was
Oh.
kind of unique that he gave me this, and then he goes into, if you would like more detailed information, I can get that for you. So I think he's looking for money. We paid with UCFS and TVCCA years ago for some of his data. And I did it because some of my colleagues had done the same. But then when we actually looked at the data from a health point of view, it wasn't something that was all that helpful to what we were doing with our needs assessment. So we didn't feel like the donation to Mark was all that helpful, actually. And then when I look at the tabs, they're very, he included 2015 to 2024 data. So I don't know if he needed that to be able to give a big enough sample size to be able to give us data that was relevant, but that's a huge amount of years for somebody to pull together to be able to give us what he would think was relevant data. So I don't know, I've always kind of
Right.
been uncomfortable
that's
with
one of the
that
reasons-
approach, to be
Yeah,
honest.
that's one of the reasons why we developed the C-band surveys, because we felt like his data sets and that criteria were not equitable in terms of the way that they were collecting the data. But I was thinking just even the census data or the things that he's pulling in just to sort of level set what it looks like in terms of our
Even his
ethnicity.
demographic data, Joe,
ethnicity.
I didn't feel like he had as broad a reach as I had thought he had in the past.
Okay.
When I started looking at the demographics, it seemed like it wasn't as diverse as I would have hoped.
Okay. Missy, I know you unmuted. Did you want to have a comment on this too?
Is she read the screen? I think she's.
Sorry, my computer crashed and I had to get on my phone and then my phone was having issues. Sorry. Yeah, Sue, just a thought. The Data Haven data, before we just kind of throw it in our report to expand on the, the information being presented, I would say we should look at it first if we are going to include it in
No, I
our
agree.
report, because it needs context and how is it relevant or tied
Okay.
to anything we're recommending in our report, and, just to help tell the story or not. How that info, Patrick's right, the quality of that data is not overwhelming. And I just think we need to give it context if we're going to include it at all.
I agree 100%. And that's why, from what we do with our community health needs assessment, that's why we're really expanding on that data. And I didn't even pay for like metropolitan area level for Data Haven this year, because I know that the criteria is so high that we end up getting not applicable in many categories. But that being said, do we think that there's a need for us to be able to gather some data from certain sources to be able to go alongside with this report? And if so, what kind of data are we looking at? Are we just looking at like census data, makeup for that? Is this getting too deep in terms of the plan? Should we say like, well, we're just going to stick with the survey information? Sometimes I think it's an opportunity, and especially since a lot of us have our hands in all of this data right now, it might be an easy way in. So what kind of data, if we're looking to put data into this report, what kind of data would we be looking for is my question to the group.
First, I just want to make a comment. I agree with Lucy that we need to make sure this data, in our opinion, is credible. I think it's a good opportunity to take a look at it. It's right there for us. So I think we should consider it, but then consider once we look at it, is this going to distract from the scope of our assignment, which is to provide the survey data?
Right.
Does council really want this? What are our thoughts on that? And
Right.
That's rhetorical. I don't want to
No, I think that's a great question.
and cluttered with information they're not
Mhm.
really looking for.
Yep.
But I think we'd be foolish if we just ignored it now without even considering it. Yeah.
Good point.
Yeah.
Other folks weighing in, what do we think?
Well, sure. Of course, I love more data, and if there's a way to give, a backdrop to Norwich as a whole while we're providing what we've collected to be best practices addressing those issues, I think it makes sense. I mean, context is important. So if there's a way we can reliably craft that context in this presentation, yes.
I would just add that perhaps we just stick with census data. It's the most verified and vetted of all the platforms I've heard you guys discuss so far. So there's data there, but it's not as in depth, and we don't have to worry about any types of survey errors or anything like that.
I know also though with census data, there's many of our populations that don't have access to that. So that might pull out some of our populations that don't necessarily always have access to that. I think that's me. I apologize.
Okay.
So just something to keep in mind too, in terms of access and who's getting into that data. But I agree with Chief that that is an easier one to grab, because that's just public information. Is there any data that we collect in terms of like makeup of the city, like demographic of the city, that we would all also have just in terms of ourselves?
Yes, and we have, as we went through 2024, HR improved its data collection efforts and accuracy. There are multiple forms, for instance, for hire that get filled out by the department head, get submitted to HR for approval. And one of the requirements there is to identify racial makeup.
Yeah.
It's just data that we collect, which we're entitled to collect it, obviously, by law can't be used in any hiring decisions,
right,
but it's data that we collect. So, but that's a bit of a burden on HR
To analyze it.
to analyze it and put it together. But to answer your question, yes, we do have that data. I don't think there's any harm in taking a look at what data
Okay.
data has, available.
Okay.
It's already done.
Other comments and questions about any of this?
I just remember back to the days with Bev Goulet at Norwich Human Services, and she used to always tell me she used the school profile data because it was the most up-to-date view of the city that she could find. And I've always used that myself. It's all within the last 12 months. And it just gives you a good idea of the demographics of the city just based on what the public schools have.
Great idea.
That's-
Would we have access to that pretty easily?
It's
City-
online.
HR couldn't help with that, but I
It's
would,
online.
but BOE, I think that would be a great source.
Don't we have somebody from?
Lord Dietrich, right?
It's
Right.
online.
It
Oh,
is
it's online?
It's
Yep.
readily available data, yeah.
Yep, and they do a school wellness survey too, and I think 2022 is the most recent one they had online for that, so.
So I'm gonna star that one because it's online and it's right there, and sounds like that's a good one.
And if there's something else if you want additional, I would just contact the interim superintendent.
Okay.
Susan.
All right, great. So
When is
let
our
me-
report due?
our report is due.
Yeah, when is it due?
Didn't we say April?
We said the March/April
March/April,
timeframe.
yeah.
We didn't set it
Okay.
yet.
Wait, a minute, you mean the report to the council?
Yeah, it's the
Yeah.
city council.
Yeah,
Yeah.
yeah, we're targeting for March, April.
March, April.
Because it says every 6 months, the way the resolution reads, a report is submitted every 6 months.
Correct.
And so we're anticipating this being the final
Mhm.
report, so it actually would be submitted and then a presentation.
Right.
I was just asking because of keeping a timeline in front of us of when to review data by, make decisions on it, decide how it's going to be included, produce a final report, et cetera. So just putting out that we need to kind of keep that on the radar.
Develop a timeline is what I'm hearing.
We do, we have all the final surveys are due
The 24th.
the 24th. And then there's a group that's going to work on,
Putting, analyzing the data,
Yeah.
putting it all together. And then we'll present that information.
targeting by the end of November,
Yep.
early part of
Yep.
March.
Yeah, that's the goal. So as far as collecting data and adding additional data into our report, we will look into the city of Norwich school profile data. I will check with my folks to see if the data we've already collected for the community health needs assessment through the collaboratives is data that we can utilize. Patrick just sent me the information on Data Haven, so I'll send that out to everyone. And whatever data I collect, I'll send to everyone, and it will be everybody's responsibility to go over it to see what you think, yay or nay. And then we'll come to a consensus by next meeting on what data goes into the report. And by then we should also have gotten pretty far in terms of some of the analysis for what's going through the survey data. Does that sound comfortable for everybody?
Yeah.
Okay, good.
Yep.
So that's my chair updates. Thank you for letting me have some updates. Guest speaker, I did reach out to our quality safety individual. Unfortunately, she could not make this meeting, but I will try to bring her into the next one to talk about some of this data gathering, what the synthesis looks like from a health equity perspective. So instead of subcommittee report outs, we're going to use this as a time to talk about the survey, any opportunities or barriers to completing it. I'll be fully transparent and I'll say that from my organization, it will probably be like right at the end when we get everything submitted. There are a lot of individuals with their hands in the pot. I've been emailing folks again and again and again. You know, I don't think the questions are hard to answer. It's a lot of what we sort of discussed as a group on like why we're doing it and the history of where it comes from and who's going to see it and so on and so forth. But I did have answers for that. I'm hoping all of you had those answers too. So just opening it up to see comments, questions, concerns, barriers, issues.
Well, I think we should give gold stars to Patrick and Missy
Yep,
because they're the first two to get theirs completed and in.
very well done. We
And
appreciate that.
yes,
Leading the way,
so
leading the way.
good job. And then Rob has sent an ask out to department heads, and I'll be like aggregating all of their answers into a cohesive city answer. And 5 department heads have answered that survey so far for Rob. So
Wonderful.
that is what we have so far.
11.
Perfect. Okay, that's a great update.
But Kate, how about I share the good question we had from early on from one of the department heads about, you know, are they to answer this question as a city department head just for their department? Or should they also think about kind of a 2-for-1, a larger response for the city as they see it? And we thought that was the best answer is answer it, of course, at a minimum for your department from that perspective. But a lot of the questions, if you wanted to, you could broaden your response because you have a knowledge of the way the city beyond your department works or should work. So we thought that that was helpful as a way of allowing them to have a little bit of free reign to go beyond their department.
Yeah, I mean, as long as, you know, we're going to be able to really represent what, you know, best practices look like and be able to talk about all the great work that's going on in the city. I mean, those are really our overarching goals with this report, right? One, to share what we're all doing so everybody's aware. and two, to sort of set a standard or have an opportunity of what some best practices are that should individuals want to engage in that, they could. Other updates for organizations filling these out, barriers, tricks, tips?
Well, in terms of tricks and tips, we had an advantage, I guess, because I built the form, but we're having all of the department heads answer the survey directly rather than distributing a Word document just for their section to them. So in that way, we've cast a wider net, but also just to have their answers right in the survey results. And so that's from there, I'll take it and, smush it down into a nice, presentable, digestible presentation. But that's something else that if you are finding chunking it out into different Word documents to different department heads within your organization, reach out to me and we can coordinate the same kind of effort where they just use the survey link and just put NA or, ask Joe Zuzel or whatever if they don't have the answer for that particular question. So there's a technological workaround if you're finding it to be clunky.
Good, that's good. Yeah, unfortunately, Joe Zuzel's name is next to a lot of those questions, but it is what it is. Any other feedback about the survey? Everybody's going to be able to get this in by the 24th. We're all confident that all the agencies represented here are going to be able to get that in by the 24th. Okay, awesome. Do we want to use a little bit of time to just talk about next steps once we get all of the data? Do people have questions about that? Do we want to sort of formalize more of a plan? Right now, as Sheila said, there's a committee, myself, Kate, can't remember if there's Rob.
Oh, I'm told.
Yeah,
That's
yeah.
okay.
So we're going to be working on putting it all together and coming up with a final product for that. And as I mentioned, if we do want to include some data, we'll get that out to you ASAP. Figure that out.
That is important. It's the benefit is to the city. That you should
Makes
have your
sense.
eyes on it.
Makes sense.
All right. Any other questions on this? I know I've said that like 100 times, but if there are not, I will believe all of you and I will entertain a motion to adjourn.
So moved.
Awesome. A second,
Second.
please. Great. And all those in favor, say
Hi.
aye.
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 Raise your hands.
You have to do
Aye,
it by roll call if you're doing a hybrid. Come on.
All right.
You can't change it in the middle.
Patrick McCormick,
Aye.
Dr. Qureshi,
Aye.
Chief Daly,
Aye.
Melissa Myers,
Aye.
Dr. McLean,
Aye.
Kate Mildy,
Hi.
Sheila Hayes,
Aye.
Rob Scalise,
Aye.
Joe Zuzel, aye. Motion passes. We are adjourned. Have a wonderful day, everyone. Please